Good morning, everyone. Welcome to Coffee Break with Card. Coffee Break with Card is a program dedicated to all those in our community who are living with autism. It's La Hora del Cafecito's new sister show. With today's program, I'm usually confused at this time because I come from La Hora del Cafecito. So bear with me. In today's program, we have the pleasure of interviewing and having with us in the show Dr. Yolanda Leon. She's a neuropsychologist, board certified in pediatric neuropsychology with degrees in clinical psychology in the School of Psychology, and Brianalysse Nicolena Cedeno, bilingual psychometrist in the field of neuropsychology, who has a degree in psychology. They have come to share with us important information about autism diagnosis, neuropsychological evaluations, and what this means and what comes after it. So come on in. Let us know if you're drinking coffee with us. We'd love to say hello to you. And to both of you, Dr. Leon and Brianalysse, welcome to the show and good morning.
Thank you so much for having us. Good morning.
Thank you. Anyway, so like I said, before we get started, let's introduce to you our coffee break hostesses. My name is Yolanda C again. I am a card consultant assigned to the primary age group, and I'm also professionally a pediatric physical therapist as well as a special education teacher. I am joined by my colleagues, Olivia McDonald. Buenos dias, Olivia.
Buenos dias, Lourdes. Good morning, everyone.
And Maggie Aldana. Buenos dias, Maggie.
Buenos dias, Lourdes. Good morning.
Olivia McDonald is a professional in the field of public health, and she is a card consultant assigned to the primary age group, just like me. And she is the mother of a beautiful toddler and has a younger brother who is diagnosed with autism. Bienvenida, Olivia.
Thank you, Lourdes.
Miguel, that is an excellent special education teacher, and she's the previous chair of the CARD Constituency Board and is the mother of 3 children, 2 of whom are diagnosed with autism. Welcome, Maggie.
Thank you, Lourdes.
Desmond Castellano couldn't join us this morning. She's attending a committee meeting in the community, but she's usually around somewhere. So hello, Jasmine, somewhere where she was with us in La Hora del Cafecito, just, peeking in always to say hello. So I'm not surprised if she peeks in again. But anyway, before we get started, we want to review the rules that we want to adhere to when we're in the air, just to ensure that we have a safe environment for all of us. So be sure to keep an open mind, a positive attitude, and use respectful language. Olivia, do we have someone to say hello to before we get started?
Yeah, so hello again to Yasmin.
Yeah, I told you. Hi, Jasmine. Thank you for being here.
And also good morning to Mark and to our number 1 fan, Philomena. That's my mom.
Hello. Hi, Philomena. Good morning. Thank you for being with us. Today's program is amazing. Thank you. They're all amazing. We love what we do. Anyway, as I mentioned in today's program, we're going to be talking about how to deal with the post diagnosis, and also what the diagnosis of autism is, all the psychometric examinations and everything that goes along with this. We have with us Dr. Yolanda Leon, and we also have Brianalysse Nicolena Cedeno, and they're going to be telling us again about the autism diagnosis, the neuropsychological evaluation, and what this means. So come in and join us. We have a lot to talk about. Okay. So before my first question to you would be, I guess, can you tell us a little bit about each of you?
Good morning, everyone. Yes, Lourdes, absolutely. First of all, thank you so much for inviting us onto your show. It's a privilege and an honor, and we're very proud to be here. My name's Dr. Yolanda Leon, and I'm a neuropsychologist that's board certified in pediatric neuropsychology by the American Board of Pediatric Neuropsychology. I'm an assistant professor at USF Health, Morsani College of Medicine, and the neuropsychology division is part of the neurosurgery department. I'm an assistant professor there, and I'm a provider with extensive experience working with children and adults through the lifespan. I've got extensive experience working with Latinos, Spanish-speaking, bilingual, monolingual, and throughout the entire lifespan. I have both a personal and a professional interest in autism spectrum disorder. More specifically, since 1986, for about 36 years, I've been working with and evaluating children with all kinds of neurodevelopmental disorders. And personally, I love animals. I love my family. I have a 93-year-old father that I'm blessed with. And I love anything that has to do with cooking, music, and Latino culture. I'm also very blessed to work with a wonderful neuropsychometrist who serves as a psychometrician and an assistant and has a wonderful clinical eye. So I'll introduce Brianalysse.
Thank you, Dr. Leon. Good morning, everybody. Thank you, Lourdes, for having us. My name is Brianalysse Nicolena Cedeno. I'm a bilingual psychometrist in the field of neuropsychology. I have a degree in psychology, and professionally, I hold about 7 years administering neuropsychological assessments to Spanish-speaking Latinos, both bilinguals and monolinguals of all age groups. And then working clinically, I've been here at USF for about 3 years now. Okay, so I do work in the neuropsychology division, USF Health, Morsani School of Medicine. And I work primarily under the supervision of Dr. Leon. In my personal life, I'm the founder of a research-based organization called Afro-Latinos contra Alzheimer's, or Afro-Latinos against Alzheimer's. And particularly, I do have an interest in the growing field of neuropsychology within my fellow Puerto Rican community, both on the island and here in the U.S.
Awesome. And welcome to both of you. Wonderful background. Thank you for sharing.
Thank you. Thank you for having us.
Maggie?
There we go. I finally got the mute button to work. Good morning to you both. Thank you for being here. I did want to ask you, what are the diagnostic criteria for autism?
Well, that's a great question. One of my favorite questions. And the most important thing I want people to know is that there's actually a formal criteria. And we use the Diagnostic and Statistical Manual. We're now on the 5th edition. It's called the DSM-5. The DSM-5 is the sort of mental health Bible that we use to determine whether or not our patient meets a certain criteria. It's published by the American Psychiatric Association. And autism is one of the disorders known as a neurodevelopmental disorder, which is a group of conditions with the onset during the developmental period. The criteria is very specific, but it must be formally assessed using different tests, an emphasis on tests, many different tests, review of the history of the child based on what the parents tell you, on available records, medical records, educational records, any records that involve some observation of the behavior of the child. We can look at speech and language therapy records, physical and occupational therapy records. Sometimes that's all we have, and they're a gold mine because they have very specific observations of the child's behavior and skills and what they're able to do at a given point in time. The criteria is very specific. They must demonstrate persistent deficits in social communication and social interaction. So they have difficulty with social and emotional reciprocity. They often don't interact with others. They don't play with other children. They don't communicate necessarily. Some can, but often they do not. particularly for the purpose of social interaction. You might see lack of facial expression, lack of emotional expression, and then they also will show restricted, repetitive patterns of behavior. Sometimes they're seemingly meaningless behavior, spinning, tapping a doorknob over and over again, touching parts of a vacuum cleaner. It can be anything. These criteria must manifest during the developmental period, that is between birth and age 18. That doesn't mean we can't diagnose them after 18, as long as the behaviors were manifested or present, the behaviors, the delays were present during that developmental period. They must cause significant impairment in social, occupational, or other important areas of functioning, like how they function in school, how they function at home. If they're 16 and they are trying to get their first job, how they function at work. The other part of the criteria is that it's not better explained by intellectual disability. Oftentimes, children are referred for a diagnosis of autism or differential diagnosis to determine if they have autism, and they may turn out not to have autism, but they do have intellectual disability. If it's intellectual disability alone, then they don't meet the criteria for autism.
That was such a wonderful and thorough explanation. Thank you, Dr. Yolanda. Can you please explain how the diagnosis of autism is provided to the families?
Yes, I'll tell you what we typically do, and what most clinicians typically do is we do a battery of testing. We have them come in for an evaluation. Now, I want to make a point that we often get calls at USF Health where parents will call and say, I need an appointment for an ADOS evaluation. ADOS is one of the diagnostic instruments that a clinician can use to help make the diagnosis or not of autism. We do not use the ADOS, and you don't have to use the ADOS. As far as I know, there's nothing magical about the ADOS. It's kind of a complicated system where more than one examiner has to observe them and they have to do certain behaviors. We don't do that. We use actually the Gilliam, but there are other instruments. They're all very good as long as they use a gold standard instrument. That's what's important. So I want to clarify, because we think sometimes other doctors don't want to tell the parents they suspect autism. Sometimes they do, but there's a subset, a handful, that say, I think you need an ADOS test, and they don't really tell them what ADOS measures or what they're thinking. And the parents will call and we tell them, we don't do the ADOS, but we do an evaluation. And often they'll say, okay, never mind, I need to find someone to do the ADOS. They usually can't find someone, and then they end up coming back. And when we see them, they come in saying, I really need an ADOS. We have to clear that up. So you need some measure of autism behaviors, a rating scale typically that the parent will do, or an interview where the clinician interviews the parent and checks off the things on the list. But that isn't how the diagnosis is made. That's part of it. That's one of the many measures we do. So we do some testing. Physicians will often informally make the diagnosis. They'll send them and say, rule out autism, or they'll diagnose them with autism. They still need to come to a neuropsych evaluation, because most agencies that provide services in the state of Florida require a licensed psychologist to make the diagnosis. And why is that? I believe it's because we as neuropsychologists don't make the diagnosis informally based on anecdotal information and just observing the child briefly. We do about a 4-hour battery of testing. Sometimes it's shorter if the kids are younger or if they're too impaired to be able to do much of the testing. But we do a battery of tests. We look at everything we can, and we ask for it before they come to the evaluation. All sorts of medical records, pediatric neurologist, any educational or daycare records, speech, occupational therapy, physical therapy, anything that's available. And based on the history, the test results, the presentation, the observations, that's how the diagnosis is made, provided they meet the DSM criteria. Brianalysse can tell you more about what the actual testing involves.
So I want to just quickly add on to what Dr. Leon mentioned by saying that, yes, only a licensed psychologist may offer a clinical diagnosis, but it's important to keep in mind of where you're attaining the diagnosis. So at USF Health, in the neuropsych division, because we are bilingual, we do get a large population of Spanish-speaking Latinos. So us as Latinos, we must recognize that there's a cultural variance that exists within our Latino population, and by such, a credentialing variance that's going to exist. And what I mean is that, interestingly enough, across Latin America, the degree necessary to identify as a psychologist, it actually varies depending upon the country that you receive treatment from. So for instance, in Venezuela, you may identify as a psychologist with just a master's degree. So if you're being evaluated here in the US, just know that the licensed psychologist must be board certified in psychology. Okay, so that's either a PsyD or a PhD, and usually they'll want a pediatric specialty preferred.
Excuse me. I am so happy that you're talking about all this stuff, because I do know, and I'm hoping that we get our resource department to be able to sign on with us, and she might be able to answer more specifically for our parents the issue with the ADOS specifically, because I do know that for what I remember, the ADOS Medicaid, if I'm not mistaken, Medicaid requires the ADOS for ABA services, for example. So that might be one of the reasons why you're getting a lot of the people requesting that in particular, because insurance-wise, that's the that they have, and they need to have that covered. So that
I think also from what some of the families I've heard give feedback to, also it's some of the therapy offices, I think, are under this misunderstanding also that you can only use an ADOS, and so they're thinking it's either it's just like an informal diagnosis or an ADOS, and so they're putting that requirement on the families to get services. Yeah.
Exactly. So we'll try to find out the specific, because I know the Medicaid aspect of it. So I kind of texted to see if I could get someone from our resource department to try to help us out with that answer. But nonetheless, that may be one of the reasons. And as you mentioned, Dr. Leon, that the other one might be that parents don't know that there's other options and things like that. But I think, again, they're just repeating what is being told to them.
Sure.
So thank you, Olivia, for sharing that.
Yes, thank you, Olivia. It would be great if we could get some clarity on that, because there's two issues. If it is required by Medicaid to pay for therapy services, then it becomes an ethical issue for us that do we allow insurance or third-party payers to dictate how we conduct our assessment? We literally this past week had 2 children who were administered the ADOS and still referred for differential diagnosis, but the parents had been told in no uncertain terms that the child didn't have autism because the ADOS didn't show that they had autism. Well, guess what? The individuals that did the ADOS were not licensed psychologists, not licensed by the Board of Psychology, and both children absolutely had autism.
Yeah.
So in one, it wasn't so terrible. The one parent was already, she knew, she didn't understand why they told her that, but she was okay with it. The other parent took a lot of theme reduction for us to, because she kept saying, but they told me last week that he didn't have autism. The ADOS didn't show it. So it wasn't an easy situation.
Great. Dee, our resource department is here in there, so maybe she can help answer us that. Because again, it may just be that I misunderstood that, but sometimes that may be it might be one of the tests that is required
Or accepted.
or
Yeah,
um,
accepted.
I don't know if you got to hear that question. Is it Medicaid only requires one test or multiple tests? Yeah, we were wondering if Medicaid only requires the ADOS to pay for ABA services, or is that one of the tests that they require, but there's multiples and so on and so forth. That's all that we wanted to find out about. What is the situation with Medicaid in terms of the diagnostic test, what it is here in the state of Florida, because it may be multiple. And some parents are confused. And like Dr. Leon says, it's only one of the options that there is, and it may not be the most effective one. But again, and what happens once the parents have a diagnosis and they happen to use a different test? Could that be used to get their services paid for? That's the question. Anyway, we must continue while B is helpful. Okay, so multiple. Here's the answer. I'm going to post it. So multiple insurances require an ADOS be performed to provide the coverage of ABA therapy, specifically as far as we have been advised. So there's specifically, so it's multiple, it's not just Medicaid, so multiple. And so that's as much as we know. Mm-hmm.
So now we know. Thank you. Thank you for answering that for us.
Thank you.
But I'm sure, perhaps, here's the thing. I'm sure that parents can call the insurance because maybe that's one of the tests that they require. And so maybe it's just that ADOS, it stands out. And so everybody thinks that it's the only one, but it's actually the insurance company says, no, that's only one of the ones that we require. But because it's the one that everybody knows, everybody sort of asks for it and thinks that it's the only one that they're requiring, when in truth, it's multiple ones. So that's probably the case. It usually ends up being that way, but it's the one that everyone knows. So it becomes like, oh, they only pay for one. But you're right.
We'll do some more research on that, but thank you.
Yeah, that sounds more likely to me, because specifically for what you said, Dr. Leon, it's an ethical issue. I doubt very much.
Yeah.
That they.
Then I was going to say, Dia also put this comment here.
Yeah, right. So I have spoken to parents that have fought this directly with their insurances and have been able to use another evaluation in place of the ADOS. Perfect. You see?
Great.
So that's what I'm saying. Yeah. So maybe they just don't know. They're limited. So again, they're limited in their knowledge, and they say, oh, that's the one. That's the one. So it becomes the test because it's the one that they know about. And they haven't done research in that. But if parents, again, like you say, informed parents can then educate their insurance companies and say, no, there's multiple ones, and this is a better one because this isn't that. And so, and then she says, it's definitely a hindrance for families that cannot obtain an ADOS. Yeah, exactly. So, and like Dr. Leon says, the Gillian might be a better option, more thorough, more specific, and more discerning of the real.
And if we go back to the previous question about what the criteria is, we literally, in our report, we bullet out the criteria and how the child meets the criteria. Okay. So if they have a restricted range of interest, which is part of one of the criteria, we say he is completely obsessed with dinosaurs, will not eat without his dinosaurs at the table, behaves like a dinosaur, only talks about dinosaurs. boom.
Very
So
specific. Yeah.
right, very
Yeah.
specific. So there's no
Oh, no,
question of how they meet the criteria or not in our report.
So I want to thank Dee for from our research
Yes.
department for being here and helping us answer that question.
Yes,
So
thank
thank you
you.
so
Thank
much.
you. And
Okay.
so quickly. Thank you.
Thank you. I think it's Olivia's turn. I may have gotten lost. No. Where are we?
What happens after diagnosis?
Yes,
What is
yes,
the
it is.
neuropsychological evaluation?
So I just want to say that by the time the patient has gotten to our clinic, because our specialty is neuropsychology, then that means that the family has obtained for the patient a referral for a neurodevelopmental or neuropsychological evaluation. Okay, and what this essentially means is that the child, apart from maybe having autism, also has a neurological comorbidity. Okay, so it might have come from the child's neurologist, pediatrician, psychiatrist, but as long as they meet that criteria, then they'll arrive to our clinic. Okay, us as psychometrists, we approve the visits, and then the patient and family arrive for the neuropsych eval. So essentially, a neuropsychological evaluation is an in-depth assessment of skills and abilities linked to brain function. So as I tell the families, our ultimate goal is to establish what we call a baseline, okay, or a point of reference of cognitive functioning by testing their cognitive strengths and weaknesses across several domains. Okay, so this includes attention and concentration, their processing speed, memory, language, which becomes especially important in the case of our bilinguals, and then some other domains as well. So me as a psychometrist, I don't operate independently. I work directly under the supervision of a neuropsychologist, who in this case is primarily Dr. Leon. My role is to administer and score the neuropsych testing. But as I like to say, it's also to be the eyes and the ears for the provider, since I'm usually with the patient for the majority of the visit. So I take, very detailed observations to provide to Dr. Leon, so that way she, ultimately makes the decision of whether she feels the patient will truly meet the criteria for autism. So our testing spans, it's pretty lengthy. It spans about 3.5 to 4 hours. Yeah. And it's during this time that I take advantage of making these observations, which typically do demonstrate that the patient exhibits autism-like behaviors. And then I won't get too in-depth with the statistics of it, but using certain algorithms, each assessment produces its own scores. Okay, so there are standard scores, scale scores, percentiles. The important thing to know is that each of these scores is compared to what's called the normal population or neurotypical population of persons of their similar demographic. So we're talking of similar age, similar ethnicity, level of education, etc. And then depending upon how far the patient is from this norm, that is to say how big the difference is between their scores and their peer scores, that tells us what the patient's level of functioning actually is. So during testing procedures, this is just a little caveat I kind of want to add in there too. It's only myself and the patient in the room. And this is done to prevent the parent from intervening and unintentionally trying to help or coach the patient into providing a response, because we really need to get an accurate sense and an accurate depiction of what it is they're truly able to do. So only in special cases, if the patient really has significant separation anxiety, may the parent be allowed to sit in. But they're always, told, and it's emphasized that they're not to intervene.
Okay.
Yeah.
And what happens post-diagnosis, once they have gotten that diagnosis of autism?
So once all of my testing has finished, and for the most part, I've calculated the majority, if not all of the scores, Dr. Leon, she's the one who meets with the parents to inform them whether, in her expert opinion, she believes the patient meets the full criteria for a diagnosis. If a patient does meet the criteria, then we provide the parent with our standard packet that we created, resources, which kind of functions as a go-to guide to help them through the process. So one thing we don't like to do is simply diagnose and then send them on their way. It's autism particularly is a difficult diagnosis to provide, because we're dealing with kiddos and toddlers and Latino families, and we want to show them that we're here for them. So this is especially important in the context of informing the parent that not only do they have autism, but they have these other cognitive deficits or developmental delays as well. So that can be a lot to handle in one sitting. This is a 4-hour visit, sometimes can extend to 4.5 hours if the interview goes over. So we just want to let them know that here's a list of available resources that can be provided to both you and the patient to help them get back on track to more developmentally appropriate age, and to reassure you that you are not alone and that we're going to try to do everything we can to help the patient. Okay, so the packet serves as a roadmap or a set of steps for the parent to follow to get these resources. And some of the names are, of course, CARD, so Center for Autism and Related Disabilities. We also have the Florida Network for Disabilities, FND, Agency for Persons with Disabilities, which is the governmental agency that can provide them with services through their medical insurance. And then more kind of like tutoring services and education-driven programs such as SEEDS. So the Supporting and Empowering Educational and Developmental Services. So lots and lots of resources.
And it's wonderful that to hear that, you go above and beyond just providing the diagnosis and the services. And in the show before, in the Spanish version, we had this conversation where, you really empathize with the families. And at times you mentioned, Dr. Leon, that you may share with the family that, you do have a personal link to autism, so you can understand with them what's happening. So I love that. Also, I wanted to say that you mentioned that you're working with Latino population, but just to say that that's not the only population that you work with. So it's open for everybody. It just happens to be that it's specifically if you need that for those families, or of someone that needs those specific services. Just wanted to clarify that for those who are watching this, whether now while we're on the air or if they're watching this later on. So you provide services for everyone in the community, children and adults alike. So wonderful.
Absolutely.
Yeah. Anyway, so I am also trying to figure out if we have any comments right now. Okay. Continuemos.
Yes. What is the emotional impact of autism once your families come in and they go through the evaluation, and how can parents and or family members cope?
That's a wonderful question, because every parent is different, but generally you see the same trend. I think most parents, when they come in already, if they don't already kind of know that they're going to receive a diagnosis of autism, they definitely know that something is definitely not neurotypical. Something is very wrong, and their child is different from other children. The way I conceptualize it is that the way that we see the parents go through the emotional impact is very similar to the stages of Elizabeth Kubler-Ross on death and bereavement. And to summarize it quickly, the first stage is denial. Usually by the time they come to us, that denial is already starting to break down. But it's not broken down completely. So when we tell them that we're making a diagnosis of autism, oftentimes parents will cry. They'll respond sometimes in shock. And we try to be empathetic and supportive, because we know that this is a very difficult process. But even though they're still in a little bit of denial, they've already started to accept that their child likely has autism. After that, and we don't necessarily see this in the office, comes the anger stage. Then they get angry. Why me? Why my child? Why did God do this to me? Maybe if I had taken better care of myself, I'm angry at my spouse because they're not here to help me deal with it. Or if they had helped more, and they go through all of that anger stage. Then there's bargaining. That's a stage where they mentally enter a process of trying to postpone or kind of distance themselves from the reality of the situation, or bargaining with God or the universe or whatever it is that they believe. Maybe if I work harder, this will get better. And depression is the next stage where they've accepted the reality. They're not necessarily angry anymore. They're too tired to be angry. And then depression is the next stage. And then finally, they get to a point where they accept it and they start to be able to see the joy that can come with having a child that's on the spectrum, that has a neurodevelopmental disorder. I have guardianship of a 30-year-old with autism. I consider him my bonus son. I took guardianship of him because my cousin passed away and left this 20-something-year-old adult that's almost nonverbal and very, very dependent for his survival. And I didn't want him to go into some sort of a state agency or situation because I was already very close to him and loved him very much. And depending on the situation, it's not right for every patient, but sometimes I will tell them, I have someone on the spectrum and it brings joys that you can't imagine. Is it hard? Sometimes. Do I wish it were different? Sometimes. But I also know that who he is what makes him him. And he's our family's joy. And we take him everywhere and we include him in everything. And he has his own sense of humor. Sometimes that brings parents comfort. I think because they understand that I'm not just telling them this clinically and I have no idea what they've experienced. Sometimes I don't share it because I don't necessarily have that rapport with that parent, or they're more closed. So I don't tell them my life history, but I will tell them that very small piece. And most parents find it very helpful because I think they feel heard. By the time they come to us, they've seen 5 or 6 clinicians. They haven't gotten answers. They're afraid, they're heartbroken. And what we give them, besides a diagnosis, skill, testing, we give them time and we listen to them. We hear them. And I think that's just part of the role of a neuropsychologist. I don't think necessarily that it's anything special about us. I think that that's part of the neuropsychologist's role. And so we tell them this is going to take time to adjust to, but you're going to be okay. The packet makes a big difference. We give them a roadmap. And I think Brianalysse is going to tell us more about that.
Yes, we do give our patients a packet of resources, which usually help them to better navigate the roller coaster and the emotional roller coaster that they're now experiencing. But, I just kind of want to also say that because we're with the patient and the families for a limited time, not all the patients experience every stage of grief. One of the most overwhelming ones, which can be acceptance. So a lot of times patients stop at the bargaining and depression phase. And so our packet of resources can help put things more into context for them to get to that eventual stage of acceptance. So we include social media groups in our packet and other public platforms that are specific to autism, governmental agencies, community agencies, just to introduce the idea that they're not alone. We want them to know that every facet of emotion that they're experiencing can be normalized because there are also other families experiencing similar hardships. And then also to let them know that our goal truly is to provide the patient with as many resources as possible to get them back to a developmentally appropriate age. Is that certain? It may not be, but that's our goal. And I've even seen some follow-up children too, and say a year or 2 years that want the neuropsychological evaluation for follow-up with Dr. Leon. and they have shown improvements. So it is possible. I just want to, drive the point that if acceptance is not had within the office, it's completely normal.
Right. We try to normalize their experience. And there's two other things I want to mention. In that packet, there is now a program that the Hillsborough County Sheriff's Office has called Project Safe Encounter. We put that information in the packet now as well, because they have created a program where they can register their child with the sheriff's department online. And if anything ever happens, that child will come up immediately in their computer as a special needs child, and it'll identify if they're not verbal, if they self-injure, if they don't understand, if they don't have comprehension. And that is to make sure that they have a safe encounter if they ever encounter the police. Parents will often say, well, he's 3 and he doesn't run off or anything. And I use the example of, but what if your house catches on fire? Lord knows we hope that never happens. But if your house catches on fire at 3 a.m. and the house is filled with smoke, what the firemen typically do is come in and say, fire department, call out. Well, if they know that you have a 3-year-old in the house that can't call out, that can't respond, they're going to go first to find that 3-year-old and get them out of the house, right? Or if it's a 16-year-old and they are walking up the street by their school and they just got a call for a 16-year-old that took something from a 7-Eleven, and they say, hey, put your hands up, stop, put your hands up. And they keep walking, they're not going to be able to listen to what the deputy is saying, and we don't want them to get tased, right? I know if it were my boy, he might turn around and say, where's Barney, right? And they might think that he's making fun of them and put him in handcuffs. It would be terrible. So we explain to them why something like Safe Encounter is necessary, and that's in the packet. And then the last thing, that's the last page of the packet, is the poem Welcome to Holland. And I usually
share.
Right. I usually tell parents to read it when they go home at the end of the day, because we think it's important to leave them on a positive note, and so that they'll know that there is joy even in this diagnosis.
Which is something that we love to do in this program as well.
Yes.
Always bring people joy and bring people hope, because that's what really, really is about. But we really are way past our time. So I know that we wanted to share that poem. It's one of the things that I know you wanted to share. So we're going to try to share that at the end of this. Anything else you want to share before we go?
Just my thanks for affording us this forum to be able to share our experience and hopefully bring hope to parents that have been in this situation. We want to tell you, CARD is our best friend. You're right behind APD. You're second in line, because parents don't know about APD, and we think it's important for them to register right away. But you've all been wonderful. I want to say how proud I am of Brianalysse and grateful that she found this show. And we're both very proud to be part of USF Health. We hope that we have something to offer the community, and we hope that parents will know that they're cared about when they bring their children to us or their loved ones.
And it sounds like they are in wonderful hands. And yes, I love that you shared about the police program. Here at CARD, we have tons of safety programs that we really bring to the community, because safety is so important for us. And we have different water safety, the police program. We work directly with all of the first responder programs. So thank you for sharing that and doing your part to also keep our community safe. We really love that. So, but we are really definitely going over our time here. So, but this is important information, and I really wanted people to get this information. So I want to thank you for that. So for those of you that are watching the show right now live, I know we have some comments. I think Olivia has been helping me out, putting those on the queue here. So I'll be sharing those in a second. But if you're watching this after we go off the air, you still have questions, go ahead and drop them off in the comment section. We'll be sure to answer them or pass them along to Dr. Leon and Brianalysse to see maybe they can answer your questions. And also, I wanted to thank you both, Dr. Leon and Brianalysse, for helping us to bring this important information to our audience. We really, really love it, and we hope we can bring you back at a later time and maybe touch on another subject that is important. And, you know, if you leave a comment and we make another program based on your comments, we'll be sure to give you credit for that. So thank you. Thank you. I also wanted to let people know that that we are going to be coming back on the 23rd. But before we get to that, let me go up with the comments.
Yeah, there were some comments, but there's really only one question, which was whether if people can get access to that resource packet even if they haven't gone through a diagnosis with you.
That's a tricky question, Dr. Leon, if you want to answer that.
Yeah, what it involves is giving people advice outside of the therapeutic relationship. And Florida law is kind of funny about that. So I would be hesitant to give out packets to anyone that we haven't seen as a patient, just because Florida law is pretty specific about who is defined as your patient and to whom you can give advice. And that might be considered giving advice. When we give it to our patients in the context of the therapeutic setting or the evaluation setting, we document it and it becomes part of our record.
Yes.
Now, all of the resources within the packet are public, and you know, in theory, yes, one might be able to look it up on Google or do their own research, but just keep in mind that majority of these organizations, because they are governmental agencies and medical insurance is used, will still likely require a formal diagnosis.
And or a referral. Yeah.
Yes. And so we have various comments here also. So we have the question that do we, CARD USF, have resources that can be made available? And I don't know if Dee is going to answer that directly out of that. And let's see what Dee says. And she says, we tailor, which is what I was going to say. Thank you, Dee. We tailor our resources to your specific family needs. So once you have registered with us, we're gladly able to accommodate the resources according to your needs, which is exactly what we do. So based on your needs is what we do. So every time we take a call, I know it takes me forever, and you receive a packet from me, and I know from other consultants, you'll receive plenty of resources. And I tell parents, don't get overwhelmed. Eat this elephant in little chunks because it's a lot of information. Just set it aside, open a folder on your Outlook or whatever it is that you have for your email, and just go resource by resource, because every time you open up, it's going into a new rabbit hole. It'll take you to another one. So Maria Montel says, thank you for this information. We appreciate it. So thank you. Also, Dee mentioned something that I wanted to comment on, and I comment on this in our Spanish side. She says, if you are interested in registering with us, here is the link. We're going to put that. Olivia's going to help me put it on the comment section. No, she already put it. Never mind. It's already there. I'm doing Jasmine jobs. Multitasking here. Anyway, this is the one that Dee mentioned. No, that's the same one. You see, I'm not as versed as Jasmine is. Oh, here's the one. Here, Dee, this is the one that you mentioned that I run into parents. They run into needing APD later in life, and they haven't been started in the wait list. And I always say that for those who didn't get a diagnosis when they were young, then they later on, if they need services from the Agency for Persons with Disabilities and they didn't get that diagnosis from childhood, because it needs to be, like you mentioned, a developmental diagnosis, then APD really can't accept them just because they have autism or show signs. So it needs to be, you need proof that the onset was in childhood. So unless you have records and have kept those records from school and from therapies and all that stuff, and it's going to take, so getting the diagnosis early on is the way to go. And like Dee is mentioning here, registering with APD and getting on that wait list is worth doing it. And once you're registered, if you move, be sure to let them know that you move and update your address. Otherwise, you'll lose your place on the wait list. This is straight from them. Okay. We definitely got to go. We're running late. So this is a wonderful conversation. Look what you started, Dr. Leon and Brianalysse. Anyway, you're muted, Doctora. What did you say? Oh, no. I thought you said something. I'm sorry. Anyway, so again, I wanted to thank you, Dr. De Leon and Brianalysse, for being here, for helping us bring this important information to our audience. Thank you so much.
Our pleasure.
Thank you. Anyway, and also to remind our audience that we are coming now in the air every 2 weeks. So we'll be back on September 23rd, and our topic is going to be understanding the autism diagnosis across cultural differences. So I hope you can join us. And we also wanted to let you know that on October 1st, we are going to be joining forces with the other organizations to bring you Arts in the Park event at the Yes Fair event. It's going to be a wonderful event where there's going to be plenty of resources at that event. Tons of organizations are going to set their tables there to provide information for you. There's going to be lots of artists with disabilities performing. There's going to be Arts for All artists, as well as display of art. And we are going to have an Arts in the Park event for the first time. So you have to be there. Also, there is an adapted park at the place, food trucks, plenty of things. So for those of you who own a business that serves our community and want to exchange an adapted class for a table, let me know, call me, or go ahead and write to me at lourdesq@usf.edu, and we'll talk. All right. In the meantime, I want to remind you a little favor. Go ahead and go in that link that we're going to leave you there, and let us know how we're doing. This is how we can justify the time that it takes us to put together this programming, as well as be on the air with you. So thank you. Like I always say, even if you've done it before, every time we go in the air, we need to justify it. So thank you for doing that. In the meantime, we've got to go. So please don't forget to give us a like, share this video on your page and other people's pages that you know can benefit from this type of information. And be sure to join us here every other Friday at 10:45 a.m.-ish, so we can spill the beans on important topics related to autism as we drink our coffee with you. So until then, we wish you goodbye.
Good vibes.
See you again. Take care.
Bye. Thank you.
Have a
Thank
great
you again. Bye-bye.